Hi, this is Dave Katz with Therapist Consultants, and I have a tip for you. You know, eventually the COVID-19 pandemic is going to be over, and then you have a decision to make. Are you going to go back to face-to-face patient counseling, or are you going to stay online, or are you going to do a combination of both? Now, what's right for you may not be right for the next therapist. So I want to point out some advantages and disadvantages of going face-to-face versus going virtual. The first thing I want to just talk to you about and tell you that some therapists actually like going virtual better. Not many of them, but about 20% of the people that we talk to say they would like to stay just doing telemental health as opposed to going back to one-on-one. So that's one thing to think about. The next thing you have to think about is that it is actually cheaper in most cases to stay with telemental health because you may not have a building to rent, you may not have utilities, you may not have a separate phone system, and you won't have the costs involved with driving and things like that. And the third thing you have to remember is that, or think about, is that it could actually be less travel for you, like we said. So you might save a half-hour travel both ways every day. So it saved 5 hours of travel a week. So there are advantages and disadvantages to staying virtual. But the biggest thing you have to remember when you're deciding whether to stay virtual or go back to one-on-one is how is my patient compliance doing? If the average patient is staying with you during the time when you're doing telemental health, just like they do when you're face-to-face, then you can take your choice. However, if you find out that during the telemental health patients' visits, they drop off. In other words, a person that gets telemental health may only come in 5 times. A person that's face-to-face may come in 10 times. Well, then you probably have no choice but to stay with face-to-face for most of your meetings. So just think about it. Eventually, the COVID-19 pandemic is going to be done. Then you got to decide what part of your practice is going to be online and what part of your practice is going to be face-to-face. If you use compliance as a guideline, you'll probably make the right decision. This is Dave Katz. Thanks for listening.